Welcome to today's comprehensive session on fibroids. Fibroids are also known as Leiomyomas, which are non-cancerous growth that develop in or around the uterus. In this episode, we'll explore what fibroids are, their causes, symptoms, diagnosis, treatment options, and lifestyle strategies for prevention. Let's dive in. Fibroids are made up of muscle and fibrous tissue. They vary in size from tiny seed-like nodules to large masses that can distort uterus. There are of four types: intramural, submucosal, subserosal, and pedunculated. To understand all these types, watch our in-depth explainer video available in our Women's Health and Wellness playlist. So, what causes fibroids really? Fibroids are caused by a mix of genetic changes, hormonal influences, especially estrogen and progesterone, and growth factors in the uterus. They are more common in women of reproductive age, particularly among Black women, and often shrink after menopause when hormone levels drop. Having understood what fibroids are, the next question is, how do they affect women's daily lives? Let's explore the symptoms and impact. Fibroids can cause heavy menstruation bleeding, pelvic pain, frequent urination, constipation, and pain during sex or bowel movement. They can also interfere with fertility and pregnancy. Next up is diagnosis and treatment. Diagnosis begins with a pelvic exam, followed by imaging such as ultrasound or MRI. Hysteroscopy provides a direct view inside, while treatment depends on symptoms and fertility goals. Medications include pain relievers, hormonal therapy, and iron supplements. Surgical options range from myomectomy to hysterectomy, uterine artery embolization, and radiofrequency ablation. By the way, lifestyle choices can influence fibroid risk. A balanced diet, regular exercise, maintaining healthy weight, and adequate vitamin D can help. Remember, fibroids are not cancer, and not all require surgery. So far, we've explored the causes of fibroids, symptoms, diagnosis, treatment, and prevention. The key takeaway is that fibroids vary widely. Some women need treatment while others leave symptoms free. Therefore, if you or someone you know experience symptoms of fibroids or any other related medical condition, consult care provider for personalized guidance. Thanks for watching. My name is Kyla. If this video helped you understand fibroids, like, subscribe, and share with someone who it might benefit. Remember, fibroids are common but manageable. Click here to explore our Women Health and Wellness playlist for an in-depth explainer on fibroid types. Stay curious, stay informed.